So thank you, David, and thank you for the invitation. It's great to be sharing our work with you this morning. Firstly, I would like to acknowledge the traditional custodians of the land where I'm presenting from. Today I'm on Dharawal land and I pay my respects to elders past, present and emerging, and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters of southwestern Sydney. And I think I'm going to create a little bit of chaos here with my first few slides, but work with me. Can you all find your raise hand icon? Then we're going to do something with that. So raise your hands if you live within 400 metres of a high quality local park. So those with your hand up, you're all more likely to walk and you're 3 times more likely to do moderate to vigorous physical activity. And the quality is just as important as the proximity in this case. So hands down. Raise your hand if you live within 800 metres of 10 daily living destinations. And by a daily living destination, I mean a convenience shop, a GP or medical centre, a post office, a playground, a specialty food shop, a community centre, a pharmacy, bank, dentist, cafe, your local gym or fitness centre, an early childhood centre, a library. So if you can add up 10 of those and you live within 800 metres of all of them, you're 1.3 times more likely to walk, cycle or use public transport, and you're 12% less likely to drive. So hands down. And raise your hand if you live within 400 metres of a bus stop. You are 1.4 times more likely to walk. Raise your hand if you live within 800 metres of a train station. And you can put up 2 hands if you do both of those. But the train station, you're 1.3 times more likely to walk just by living that close to a train station. And keep your hand up if this bus stop or train station has a frequent service running at least every 30 minutes between 7 a.m. and 7 p.m. So you are more likely to regularly catch public transport and you're more likely to achieve the recommended levels of physical activity. And you're also less likely to live in Greater Western Sydney. Metrics used to calculate this livability index are those listed there. And it helps to explain why people in Greater Western Sydney have inequitable health outcomes when compared to those living in the central and the eastern districts. So we know that people who drive are significantly less likely to do the recommended levels of physical activity compared to non-car users. And Greater Western Sydney does not offer good walkability, and our rates of physical activity do reflect this. And so this map shows walkability for transport. And you can see large areas of Western Sydney where people are not able to walk for transport and they require a vehicle to get anywhere. So walking is our greatest opportunity for physical activity in our day, and we know that it is the most popular form of physical activity. And areas of public transport disadvantage in Greater Western Sydney are also reflected in lower levels of physical activity out here. We know that there are great economic and health benefits to be realised if we provide frequent bus services in new residential areas and peri-urban areas, as it enables equitable access to healthy food, employment, healthcare and daily living needs. So car-dependent communities are most vulnerable to the cost of living impacts from transport and housing. So providing alternatives to driving is the most sustainable long-term solution. And as I've said, people who use public transport are significantly more physically active than people who drive or are driven in a private vehicle. Access to well-planned social infrastructure and public open spaces is associated with improved physical and mental health. And this map shows areas of Sydney within 800 metres of any neighbourhood park greater than 1 hectare, which is an oval size, and up to 5 hectares. So if we want people to be physically active, they need spaces to do this as well. And we know that people who live close to their places of employment are more likely to use active travel or public transport to get there. And they also have more time in their day at the end to make those trips to the gym or the oval or play that sport. It's obvious, but it's also complex. So the evidence connecting our built environment to health outcomes is strong. And this is quite a busy slide. It's from the Lancet series on urban design, transport and health. And it's a great example of the evidence that's out there. It shows the direct links between urban system policies, and they're the things on the left-hand side, things like transport, land use, urban design, education, housing, employment, open space. And on the right-hand side, you've got the injury and disease outcomes. And you can see those risk exposures in the middle there, the physical inactivity and prolonged sitting. The evidence is so clear that health plans are starting to include a focus on our built environments. This is the National Preventive Health Strategy, and it talks about prioritising urban design, land use and infrastructure to support physical activity. Our National Obesity Strategy talks about creating environments that make it easier to lead healthier lives. And the Australian National Diabetes Strategy talks about driving change to support the development of health promoting environments and embedding physical activity in everyday life. And the New South Wales Diabetes Prevention Framework talks about healthy built environments and creating better planning, better built environments and transport solutions. And our healthy eating and active living strategy talks about creating environments that enable people to be more active through a systems and whole of government approach. And no surprises, South Western Sydney Local Health District also has a plan that speaks to a strategic approach to creating healthy built and natural environments. So this strategy considers local and state government priorities and plans and engages with community and industry. And there is so much that can be done in this space, but we focus in our local health district on 5 domains, and they are those listed here. So neighbourhood planning and design, transport, natural and sustainable environments, healthy food environments, and healthy housing. And our goal is to achieve impacts through systems change, social change, and environment change. And so what systems am I talking about? For us, I'm talking about all those ones on the left-hand side of that very complex diagram. It's those land use planning systems, your transport systems, housing, and that sort of thing. And the evidence shows that we need to change the way things are done. But unfortunately, none of these policy areas are actually owned or governed by health. Health doesn't decide public transport networks or priorities, and we don't have the budget to build cycleways or path infrastructure, and we don't build social or affordable housing. So what role can health play in these systems, and how do we implement all those health plans that I've just described? Well, we've had to leave our health silo and work closely with all the people in these other policy areas to support them. So systems change requires everyone to work together, and we have to break down these silos. So how are we doing that? Well, firstly, we're working with local built environment practitioners in our councils to build their capability to do more healthy urban planning and placemaking. So this includes our urban planners, designers and traffic engineers. And to do this, we've established formal agreements to employ jointly funded urban planning and design professionals who can focus on health outcomes in their business as usual within their council. So we have MOUs focusing on healthy urban planning and placemaking with 3 of our councils, so Campbelltown, Liverpool and Wallandilly. And other ways we're building capacity is by providing training and learning opportunities. And these have included healthy streets, practitioner courses, street design check sessions and masterclasses. And we've run webinars and seminars, and they've been produced through our council partnerships. And we've also supported councils by providing demonstration projects so that they can test out their new skills and ideas on practical projects. Secondly, we aim to engage the planning, design and transport decision makers early in the process of land use planning and design. We work hard to have a seat at the table while discussions and deliberations are taking place, and we participate in early planning workshops and consultations when projects are commencing, ideally right at the business case stage. So, for example, if one of the objectives for a street project is to increase walking and cycling, then everyone on that project will be working hard to achieve this. But alternatively, if the main objective for a street project is to reduce street congestion, then you will get likely a very different vehicle-focused outcome for that street. So that's just an example. So we worked with also Western Sydney Uni and UNSW researchers to understand built environment practitioners' perspectives on healthy placemaking in New South Wales. So what are the opportunities to make places healthy? What are the barriers and how can we overcome them? And we're also developing a healthy urban planning position statement for the local health district with urban planning targets for planning proposals and development controls. And our aim here is to raise the bar on what is acceptable in Southwest Sydney and Greater Western Sydney. Not what is perceived as achievable, but what is acceptable from a health outcomes perspective. And our third area of action is advocacy. So as a key state agency, we are invited, and occasionally we do invite ourselves, to respond to publicly exhibited proposals. So over the last decade, we've submitted several hundred submissions to local governments and state agencies requesting changes and health considerations to policies, proposals and plans. And ideally, if our partnerships and our capacity building and the engagement processes that we're involved in, if they're all working well, in the future, we won't have anything to comment on. And just to give you a bit of a background, so these are the sorts of things that we consider in urban and transport plans and policies to improve physical activity. So at a regional level, we consider are regional employment facilities and services conveniently accessible by public transport at a regional level, or are people forced into their cars? Is there an appropriate mix of employment available across the region? So when people are planning new areas, are certain professions forced to leave that region for their employment, or can people find employment close to where they live? And do the car parking supply and pricing policies make it more attractive to use active travel and public transport? And then at a local urban planning and design level, we ask things like, we ask for walkable catchments around activity centres. We want street networks that reduce traffic exposure and are safe for walking and cycling. And we're after lot layouts that increase residential densities and promote natural surveillance. We encourage residential densities that support viable local businesses and high frequency public transport. And that public transport, as we've said, needs to be located within short walking distances of homes. We're also after, it's also important for those local destinations to be within walking distance. And we want a mix of housing types and destinations, so that there's a mix of things for people to go to by public transport or active travel. And neighbourhoods need to be desirable for people to live in. They need to be safe, attractive and accessible. And the public transport also needs to be desirable. So it needs to be convenient, it needs to be affordable, it needs to be frequent, safe and comfortable for everyone. And equity needs to be embedded in planning and design decision making. And by now you're probably all zoning out because I'm using some language that you're probably not familiar with. And working across different systems, we've had to learn a few new languages. We've taken short courses in speaking land use planner and urban designer and transport planner. But it doesn't have to be like this. We can all speak a simple unified language that everyone understands. And someone has thought about this and they've come up with a solution, and this one's for street environments. So Healthy Streets is an approach developed by a public health professional in the UK, Lucy Saunders, and she actually embedded herself into Transport for London and has helped to bring about systems change in the way streets are considered, planned, built and used over there. And there are lots of different street and transport approaches out there, but we settled on this one for a number of reasons. Yes, it did have healthy in the title, so that helped. But also it has outcomes for people. It doesn't focus on outcomes for vehicles. It's entirely focused on people. It's backed by scientific evidence. It has a very collaborative approach, which is really important when you're working across all of those systems that are involved in streets. And the language is very simple, so we like that. And if you look here, these are the 10 Healthy Streets indicators in the middle. So the language is simple. Everyone feels welcome. People choose to walk and cycle. The streets are easy to cross. There's shade and shelter. There's places to stop and rest. It's not too noisy. People feel safe. There's things to see and do. People feel relaxed. And there's clean air. And each of these indicators is backed by and linked to quantitative and qualitative measures. So we've offered training to our councils and also to some key Transport for New South Wales staff. And we were on the working group that developed the Australian Street Design Check tool. So we were keen to make it relevant to Australian street conditions. So we introduced some measures such as shade and drinking water. And we have a community of practice that meets to support each other in implementing healthy streets in southwest Sydney. We've funded 4 demonstration grants in Camden, Campbelltown, Liverpool and Wallandilly councils to enable them to conduct street design projects that use the Healthy Streets assessment tools. To show how street changes can improve conditions for people to walk and cycle. And we've also recently subsidised 3 councils to participate in the cycleways design training to increase the quality of cycleways in southwest Sydney. So council staff can convert some of those dotted lines that they have on their maps into high quality cycling infrastructure that women, children, seniors and people with disabilities can use and feel comfortable and confident to use. So finally, just a bit of a call to action. What can you do to help create built environments that support physical activity? And firstly, just advocate. So follow your council's social media. So follow their Facebook, Twitter, LinkedIn, and do it for where you live and also where you work. Complete the surveys that they advertise and share those surveys with other people. Attend community consultations when they put those out there. It could be online, it could be in person. And again, invite other people to attend with you because these the surveys and the consultations, that's their early R&D stage when they're developing the ideas and their plans. So that's when you've got your chance to get in early. And then obviously comment when plans or strategies are out on exhibition. Because we know that our council planners and designers actually really want to deliver these things that I've got listed here, but they can be stymied by a couple of noisy complainers. So it's support, you need to support good planning and design. So if your council, for example, is brave enough to remove some on-street parking or a lane of traffic to build a separated cycleway or put in some trees or seating or bike parking, then you actually need to be really vocal in your support. We're typically an apathetic lot and often only comment when we don't like something. So yeah, we need to provide constructive comments that will improve our built environments for people to be able to be physically active. And think about the most vulnerable members of our communities. That's our equity coming in. So our children, elderly, people with disabilities, people on low incomes, people with limited English language. If we can plan and design plans for them, then everyone will thrive. And of course, what can Western Sydney moving as a community practice do to help create built environments that support physical activity? I'll leave it there, David.
It's a good question there. I didn't see that at the end. Thank you so much, Alison. That was really terrific, and thank you for the effort putting that together. I think just one observation for me, the fact that you don't actually own a lot of the assets, or is in our budgets, and you're advocating for things that's challenging. Wow. I've got a couple of questions as well, but I'd like to just open it up to the group before we go on to our next presentation. So yeah, open floor. Has anybody got any questions?
I was being patient, David, but I do. Alison, that was fantastic. Brilliant summary. Like, so good. Thank you. And congratulations to the LHD for all the work you're doing. I was just kind of curious about the IP&R process, and we got reminded last week that that it's coming round. And so, yeah, what can we do, and what's the local health district doing about engaging with that process?
Yeah, it comes up every 4 years, or this time it's 3 years, in line with the council elections. And that is, definitely that is a key time to get physical activity and environments to support physical activity into the council's local plans. So yeah, their community strategic plans at that level. Yeah, so very important to be again involved in any consultations that councils are putting out there. Any surveys that they're putting out there now, and the next 6 months is the time when they are reaching out to their communities to find out what their communities want in their plan for the next 4 years. So it is vital that people have a say and put all of this stuff out there and say, we really want more walking and cycling. That's what we need to hammer home, because that's what they'll deliver. At the moment, you get the people going, oh, it's the congestion. I want to get rid of the congestion and the traffic and that sort of stuff. So we'll never get rid of congestion. It will always be there. So let's not fight that cause, but we can actually increase walking and cycling infrastructure. So yeah, we need to be noisy about that. Yeah, definitely. Great.
Just the abbreviation there of IPR. Can you just explain that for people?
Integrated planning and reporting. Yeah. So this is the council planning processes that they have at a corporate level to guide their plans over a 4-year cycle. So they have a community strategic plan, which gets renewed every 4 years when the new council gets elected in. And then they have a 2-year plan and then a 1-year operational plan, which is budgeted for. So if we're not in that community strategic plan at that highest level for the next 4 years, then good luck trying to get anything done.
And David, sorry, can I just say one other thing? It was I thought it was such a good point that we should we've all a very practical thing that we can all do is, if the council's brave enough to put in a cycleway and then there's complaints about it, then get in there. We can write a letter. And I'd never really thought about, we've all got a bit of a responsibility from a physical activity advocacy perspective to do that in our local council if we see that. And the IP&R process provides the same sort of opportunity. Thanks, Alison. Terrific stuff.
Yeah, I think time is really important there, isn't it? So I do want to give Andrew and Fraser, our next speaker, the opportunity, but there is 3 people who are in, 2 people I think there with their hands up. So you've got 20 seconds, and if a 20-second response, Alison. So we're going to try this. So Camilla, firstly,
very quickly,
20 seconds.
20 seconds. Love the fact that you've got such good rapport with the local councils. How can we get more councils across New South Wales to be more equitable in the way that they provide their spaces? That some of their venues and their parks are out of control in how much they're charging for exercise programs, exercise professionals. I don't know whether we can get the Office of Local Government across New South Wales to be more equitable in this space, because I don't know how we can learn from what you're doing in other areas.
It's a contested area, and every council will say that there's no easy solutions to that one. And I don't think I can speak for councils, but I know that it's a headache for them.
Yeah. Yeah. And Jordan Kidd from AusActive, I think.
Hey guys, actually, us at AusActive actually do a bit of work on the council side of things for physical activity in parks. But my actual question was talking about obviously like secondary places and things. Do you see the increase of working from home practices means that more people obviously in their communities for longer, especially during the week? And will that increase councils' willingness to make their communities more walkable?
It has increased the attention that has been placed on CBDs outside of obviously Sydney and Parramatta. So yeah, it has put some increased attention into that. Yes, definitely walking and cycling, and the state government has also injected some funds into grants and programs for that as well, which has been really positive. Yeah.
Thanks, guys. And Elizabeth from the Heart Foundation.
Thanks, David. Well done, Alison. It was a great presentation. Love seeing your work. Just a quick question. Do you have a community of practice of healthy built environment across New South Wales Health? Or is it just, because I know that there's a lot of work happening in Western Sydney and Southwestern Sydney, what's happening broader?
We do have, the Ministry of Health conduct a just for local health districts though, so it's not broader than that. But yeah, as health districts, we get together every 3 or 4 months, to exchange information, but not beyond health. Yeah.
Yeah, no, I just meant for health. Because obviously you're doing that. And do you see that different districts have a different approach, or is there different levels of engagement across New South Wales?
It's very different regionally. So in more rural areas and regional areas who have a lot less staff, we're quite unique. We do have a team of 2 that focus entirely on built environments. We also have our health promotion service, which are very focused on activating those spaces and behaviour change and those sorts of things. And every district does it slightly differently, but most of them will also be keen to focus on healthy built environments. Yes.
Thank you. Well done.
Thanks, guys. Yes, beautiful, Alison. Thank you so much. And I just couldn't believe that 80% physical activity levels are impacted by the social determinants of health. So that was a real key thing for me. But now we're going to switch gears a little bit, and I'm really excited to welcome Andrew Fraser, who's the Youth Health Partnerships Programs Manager at Western Sydney Local Health District. And Andrew's going to talk about a terrific program that he's been involved in, exercise research program with the local health district and the PCYC, supporting young people from an Aboriginal and Torres Strait Islander background. So Andrew, welcome. If you want to try and share your slides there, that would be great.
Oh, you're halfway through explaining the whole thing. I might as well let you keep going. All right. So yes, I'm Andrew. I work at Western Sydney LHD, and this is an initiative, an aggressive way of tackling a lot of issues that have been coming up since the beginning of time. The health models that are currently being used and all that sort of stuff, and I'm just cutting through the red tape and getting into it. So this is actually all together as a research program, and it meets a certain equitable need. So I've got a research project. We've got all the ethics approved and all that sort of stuff. So I've also got help from Dr. Stephanie Fletcher at West Sydney LHD, and I've hired a project officer to help with this research. So we'll go through the models of health, what the research says, what's been done so far, what exactly is the Young, Strong and Deadly program, the pilot program results, and then what happens after that. So you may have heard of this deficit model. If not, it's basically how Aboriginal and Torres Strait Islanders' health is perceived, and they end up in a incapacitated position. So they're not really given a strength-based approach, and there's not much opportunity in terms of assertiveness in health view. because this happens to you. You always get chronic disease. This is your problem, and good luck with it, really. So a few more data points come out that diabetes is on the rise again among young people. Technology has increased physical inactivity. We love playing Fortnite and iPads and the like. So this is the deficit model, and it doesn't help anybody. Doesn't help the Aboriginal people. It's good to go to your funders and say, hey, look, this is this issue, and it keeps getting worse. Can I have some money so I can do something about it? But that doesn't really happen all that often. I'll show you why. So I did a fair bit of literature review before presenting this program in 2020. And not many people were looking at how to exercise in this area. So whilst there may have been some programs who did something, they didn't actually review it in terms of the application, the implementation, the adaptations that were required. So a process evaluation wasn't undertaken. 3 of them have been done, and what it showed was these 3 barriers were finance, transport, and connectivity, social connection. And so finances, connectivity with the community and culture. If the gym programs that are available, Anytime Fitness and the like, you go in there, you're by yourself, you get harassed by every other personal trainer that's trying to get your bang for buck. There was lots of different reasons why people didn't solo exercise. And also, yes, we just heard before, healthy places in Western Sydney, especially in the Mount Druitt area. It's not safe to go out on your own and exercise, and the parks aren't flash, and so a lot of people staying indoors and rather not, because you could get, as a young person, beat up for just looking different. So it's not a great environment. Then we move into the financial strain. As a young person, you don't make a lot of financial decisions in the house, so your caregivers are making the determination of your participation in sport. And unfortunately, like when I was younger, my parents couldn't afford to pay to play, so they don't, and it's easier than playing with Coke bottle for shoes. So then also, if you could afford something, and you went to a gym, you wouldn't have any idea of what to do with it. And so it really lacks a bridging gap. Well, there is a big gap between knowing how to do something and actually doing it. And so, yes, as I said before, just quickly, that there was only 29 trials. When I looked up the Cochrane stuff, was Aboriginal and exercise, or Aboriginal and physical activity. And only 29 trials were done since 1990. So it's a real big space. And if there was a trial done, it was with older generations more likely, or with adult women. So we're really missing a target group for our young populations. So we got the deficit model, remember that from the beginning. And then we have the gap in research. And so this is Western Sydney's LHD strategies that I know of. And this isn't a plight on their lack of assertiveness and engagement, all that sort of stuff. It just means that I'm highlighting a gap between these services. And that's why the Young, Strong and Deadly program exists. So the Aboriginal Go for Fun, we already know about Go for Fun, but it's dependent on families being available. And if they're working to afford rent, their kids' little program after school isn't the highest priority, because they've got to pay for school somehow. So they're at work all the time, or they've got social issues and all that sort of stuff. So it requires parents to get to the venue. So there's a transport gap. Then you've got age gap. So only up to 13 years old. After that, they're on their own. All their hormones start going crazy, and they're fighting with everybody. So parents are unlikely to take them if they're being little, rats. And then increases their physical activity. So then you get a healthy service online. There's lack of interpersonal engagement, and it's for 16 years and above. So you got 13 or 12 to 16 not being serviced. Then you've got the healthy eating, active living plethora of activities. These are great if you go to primary school, and not many of them are culturally specific, so they don't actually understand the cultural nuances and protocols and stuff like that with food and the like. So then you've got what is accessible to everybody, which is public health messaging, and it requires a level of health and food literacy to understand exactly what that means. Like 2 serves of fruit, if you've got 3 giant bananas, is that still your 2 serves? Like, that indication of size and amount and all that sort of stuff takes a nutrition degree to understand. So it's not really accessible all the time. If you're not in a position to hear it or see it, you won't know it exists. But those who have got that health messaging, it does focus on food. The kale and the quinoas and the 5 serves of vegetables and 2 fruits. Everyone remembers that ugly, weird, fruit man thing with the olives for eyes. But this healthy messaging isn't really a lot of people's reality, especially in Western Sydney, especially in Mount Druitt, and they're having to make choices about feeding themselves or feeding their kids or sending their kids to school at all, and then also feeding them. So being told that you're not a great caregiver because you don't give them chickpeas mixed with tofu means that you're a terrible parent. So what happens in the wealthy versus the healthy, sort of vice versa, we can fix that by equity. And so we ask the question is, if we go assertively and meet these barriers and meet them and overcome them, will our people be able to continue in engaging in healthy behaviours? So we'll go through that now, exactly what that looks like. So Young, Strong and Deadly program is an assertive exercise program in a nutshell. So we're targeting that missing group, the 12 to 16-year-olds who live in Mount Druitt. Its CIFA score is really, really high. People know about the CIFA score. You have 14 weeks. And I was at a nutrition thing with the Uni of Wollongong, and they were talking about new research is showing that one-off education stuff isn't working, and it's a waste of time. If not, it makes things worse. So we wanted a big program, a sustainable program that wasn't a once-off or once-a-week sort of thing, and there was voluntarily coming in and all that sort of stuff. It was a full-on progressive conjugate program, conjugate training method. So we teach them how to do it properly as well. And then we get into the social connectivity. So that's in their environment, in their healthy environment, their comfortable environment, and it's not going beyond each other as peers. So they're people who go to school in the area. We've had 4 different schools attending, and the social connections that they build with each other and the dependency on each other. The support they give to each other through the program. And we also use a program the Heart Foundation gave us, was a Koori cooking challenge. And so we set that up and teach them how to cook and get a bit of culture in their life, and get their families down and teach them how to cook as well properly, with the view of do what you can with what you've got. So we've got Coles brand butter and white bread and sausages and all things like that that are achievable for these families, making them healthy and then making them swap it, don't stop it. So the bags of lettuce, put that on your sausage sandwich, and things like that. So waffling on, sorry. But these are the major components. So education, finance and transport are all intertwined and come together. So the finance, we pay for their gym memberships, and then we give them another 6 months gym membership, because we're going to follow up with them in 3 months after the 14 weeks and see how they went and see if they went on their own, of their own volition. The PCYC that we train out of is fully invested, fully decked out, and so they can also help them with transport if that's one of the issues. But yeah, so we do pick them up in the bus, either from Health's bus or PCYC's bus, from schools, train, then take them home, and yeah, easy peasy. So this is the results. Increased performance. So their strength and conditioning, deadlift obviously went up by can't remember the exact number, but yeah, so on average about 40 kilos each. So there was a massive improvement. And then the participants, lost a kilo each. They got stronger, they got faster, they could hold their planks for longer. They then had another effect was a retention rate of 90% over 14 weeks. And so I work with Youth Health, and in I think the 20 years it's been around, it's never had such a high retention rate for as many students or young people. So having 17 young people continually come to a program, which is 2 days a week for 2 hours a day, that's 4 hours a week of their time after school, is pretty amazing. Anyway, so yes, they started engaging with their sports of choice because they had better capabilities, more confidence in their ability to get about, or they started a sport, or they started more frequency of going to the gym and continued on afterwards. So what we've shown was it actually works, and we had a lot of objection, and people were saying we should be training 12-year-olds and all that sort of stuff, but there's food problem of you can't afford everything you want to have, but physical activity can sort of mitigate any of those inherent risks that come along with it, a bad diet or an unachievable diet. So we reduced a lot of those risk factors like stomach fat and things like that. And so now we're going to officially publish with the contribution of evidence to the health promotion things. Sorry, I just got a call in the meantime. I got distracted. So yeah, that's it. Oh yes, QR code that if you've got any young Aboriginal people who live in the Mount Druitt area. Reason why it's Mount Druitt area is because it's easier for us to pick them up in the bus. So, but we're looking for about 30 this time, and we've already got 25 EOIs. So get in quick, and it will start on the September the 5th. All right.
Wow, Andrew, that was really powerful. Like incredible work that you're doing, and yeah, just wanted to acknowledge that really, and thanks for being open a bit about your lived experience, and the fact that 90% retention rate for this cohort I think is incredible. And it was really interesting you said there was only 29 trials for this type of work. Was there any others in Western Sydney by any chance?
Any other what?
You said trials, 29 other trials when you did the research.
That's Australia-wide, I think.
Yeah.
Yeah.
Wow.
So nothing specific. I think there's more coming in 2023.
Yeah.
But not in Western Sydney, no.
Yeah. I think you're gonna have many people reaching out to you because I think as I said, it's fantastic work. But I'd just like to give other people opportunity to ask any questions. So I'll go to Rania from Southwestern Local Health District. Rania.
Hi, Andrew. great work. I think the question for me is the follow-up results. Do we have those already to see after the 3-month initial period? Were they able to keep coming to the gym? Because I know you said transport and finance were issues, and I'm thinking of the sustainability aspect. How do you see that working? Are you partnering with other organizations to maybe try and provide some financial help where it's needed? Because sustainability is one of the biggest issues.
So we're paying for the gym membership 6 months post the intervention. So what we're trying to prove basically is more of a confirmation bias on my part, but basically it's saying that there is more needed from governments to support this. So if they drop off at 3 months because the finances have stopped, then we can say finance is the number one issue, and we need to incorporate that into either those, what do they call vouchers?
Active kids.
Active kid vouchers, but more assertively. So if they're not engaged, and this is what targets these groups, if they're not engaged in footy, which is all of Western Sydney, then what's for them? And there's nothing. So it's more about making sure the governments are accountable for their people and saying you need to provide a medium or to long-term solution in terms of finance. So no, not yet. It's the follow-up is due to finish probably November because it just finished. Yeah.
Thank you.
Thank you.
Thank you. Just gonna move it along. We've got 10:29, but there is a few other people with questions. So Nadine Tucker, you just unmute, Nadine.
Yep. Hi, Andrew, Nadine Tucker from Kids Rehab at Westmead Children's Hospital. Is there any room for children with disabilities in the program at all?
Yep, there's no limitations on who we have. We prefer obviously Aboriginal guys, but if they have a friend, then that's fine. Yeah, no, and I shouldn't say guys, but no gender specific either. So we've had, I should have been giving you the numbers properly, but I did it too late. But so 15. 15 young boys, and then 4 young girls, and some non-binary people. So yes, very open.
And are you able to maybe email that flyer to David, who can disseminate it around to us as well? That'd be great.
Easy. Yep.
Thanks.
It is 10:30, so if people need to go. But there are 2 other questions, and I do want to give them the opportunity, if that's all right, Andrew.
Yeah, more than happy. Let's do it.
So we'll come to you in a sec, Elizabeth. But Karen, because you haven't spoken yet.
Thanks,
from Western
Andrew.
Sydney. Yeah.
Thanks, Dave. Thanks for the presentation, Andrew. I was just curious, which were the 4 schools that you're recruiting to?
Bidwells, Chifley's, Chifley College ones, and then Blacktown Youth College, and I think some Plumpton House.
Okay, thanks.
Thanks, Karen. Elizabeth?
Hey, just a quick one. I wanted to say congratulations, Andrew. I know we've connected a couple of times, but I want to say well done. I did a program like this that wasn't called, for Aboriginal and Torres Strait Islander kids, but in southwestern Sydney many moons ago. And I know it was hard to get people and the retention, and people are like, oh, it's really hard. So I just wanted to give you applause and say well done. And it's a great program. And I know PCYC at Mount Druitt's really keen. I just wanted to ask, who's doing the research for this again to help support it? Just you? You got a university connected?
No, it was kind of, I can't say yes or no, because there's 2 tenders out, and some service level agreements have been written up, and it's with finance. So, but yes, no, the hope is to get to at least one of them guys to collect the data for us, clean it, give it back to us, and then we will do that. It's the only Aboriginal-led research in Western Sydney LHD that's ever been done. What we didn't want to do was give it away to the university and say, you can have the credit for that, which constantly happens. And then, so what we're doing is Dr. Stephanie's going to work with me and the project officer, help us write this up properly, and get it out there properly, and then we can inform the rest of the district about how to do it better, because it doesn't really do it a lot. Because it's too hard. It's in the too hard basket, Aboriginal research. It's greater than low risk just purely by being a population, not a clinical trial or a drug trial. It's just because they're an Aboriginal population, it's greater than low risk. So want to make sure that everyone who wants to do something worthwhile records it and publishes it, so that we don't keep flogging the dead horse doing bad programs over and over again.
Yeah, because if it's not published, it's not out there, right? So I'm sure there's lots of programs that have happened, but it just haven't been published. So well done. I think it's amazing. So congrats.
Yeah.
Just to keep
Thank you.
No worries.
Thanks for that. And
vindication.
Just to round that off, I just want to take this opportunity to thank both Andrew and Alison for terrific presentations today, coming at it from different angles. But these two really demonstrate, some of the great work that's happening in Western Sydney, and what we're trying to do here is illuminate that and share it and collaborate. So thank you very much, and congrats, and thanks for everybody for making the time, and keep doing what you're doing in your communities, support people to be more active, and really appreciate your time. So we'll send out the minutes and with the presentations as well, and we'll hope to see you all soon. So have a great day, and thanks again for joining. We'll see you again soon.